Hello everyone, I'm Scott Gregg. Look on almost any dentist website these days, and two things you're going to hear a lot about are veneers and bonding. There are two types of cosmetic dentistry that have become very popular among people. So we decided to ask a local dentist about veneers and bonding. What exactly are veneers and bonding, and what are some of the differences? Dr. Patrick Qatsha of the Dream Dental Group in West Bloomfield, Michigan and Commerce Township is joining us to discuss veneers and bonding. Dr. Qatsha, let's start with veneers. First of all, what are veneers?
What is a veneer? A veneer is essentially a thin laminate, usually made of porcelain, that is bonded to the front of a person's teeth. I call it the lead press-on nail of the teeth, okay? That gives you a visual, okay? They use the fake nails, they glue them to the nails to make them look pretty. We use porcelain, we glue it to your teeth to make it look pretty. With porcelain veneers, you have to prep the teeth a little bit. You have to drill a little bit of a way to make room for that porcelain so they're not big and bulky, so everything looks natural and feels comfortable.
Dr. Qatsha, somebody also said that veneers can cover up some of the small imperfections in your teeth, like, gaps in your teeth, chips in your teeth, things like that. True?
Some of the other advantages of having veneers done is that you can almost immediately, or in a very short period of time, correct misaligned teeth, chipped teeth, discolored teeth, cracked teeth. There are some people that have what is called tetracycline staining, which causes your teeth to have an innate gray color from a historical use of antibiotics as a child that they don't use under a certain age anymore. So it's a very fast way to make your teeth look good. I call them instant braces, basically.
Okay, Dr. Qatsha, so now take veneers and explain the difference between veneers and then bonding.
Bonding is the use of composite resin, so it's basically white filling material, to correct imperfections or deficits in one's cosmetic appearance of their teeth, basically. So let's say you have a chipped tooth, you cracked a tooth in half, or you just have a little bit of spacing that you don't really like, you don't want to go through braces, and perhaps your budget doesn't afford for porcelain veneers, which is kind of the next step up. What you can do is directly apply an adhesive, match the color of the composite, and then bond and hand shape that composite right into those spaces or right onto that chip. You shape it, you cure it, it immediately sticks and bonds to the tooth. We shape and polish it right in the office. You walk out of the office in an hour, poof, your teeth look good.
So basically what you're saying, if I'm hearing you right, is that bonding is a very cost-effective way to improve your smile very quickly.
It's a very, very cost-effective way to improve your smile significantly, and again, very, very quickly. I actually have bonding myself on all my teeth in the front. I used to have a very large gap between my two front teeth, and now it's gone. And that was through the use of bonding. It was done in under an hour, and it's lasted about 7 years so far, and it still looks good.
Veneers or bonding? Dr. Patrick Qatsha, the Dream Dental Group in West Bloomfield and Commerce Township, Michigan. Thanks for joining us today. Fascinating discussion on whether you would want a veneer or whether you would want bonding. I'm Scott Gregg. Thanks for joining us.